Hi, everyone. Good afternoon. I don't know when you're watching this lecture. So if you're watching at the time the class is supposed to be taught, so that would be the afternoon. Now, I hope everyone is safe and surviving this unprecedented time. Throughout the lecture today, I'm going to stop and ask you to give me some feedback. Of course, this is not live, but I'm going to ask you to send me an email, and I'm going to give you some options for us to do this. I do have office hours this Monday afternoon. So remember that if you want to come to the office hours, there is a Zoom link on Canvas. So when you go to the Canvas page, you go to the left side menu, and there will be an option for Zoom, and all the scheduled meetings for my office hours are available. There's a waiting list or waiting room. So if I'm talking to someone, you'll be in the waiting room, and then I'll get to get to you as soon as I'm done. Now, this is a long unit. There's 3 chapters. So my suggestion is that you read chapter 13 before you watch this lecture. At least read half of chapter 13 before you watch this lecture. That will make the lecture a little more easier to understand. Notice that I also posted a lot of resources, and my suggestion is that you read the chapter first. So the order, you should read the chapter first, then watch the lecture, and then watch and read some of the resources that I posted. I'm going to post some readings, but I posted some videos, and I will direct you um, on what to watch throughout the lecture, right? And when to watch things. I think if you watch the videos now before watching this lecture, those videos will not make a lot of sense, right? So they're posted there. And I'll try to make the lectures a little shorter so you also have the opportunity to spend some time watching the other videos that I would normally embed in my lecture, but I'm separating because it makes it easier to post. So today we're going to be talking about behavioral assessment. So notice that what we did is we spent the beginning of the semester talking about basic behavior principles. So the things, the variables that influence how we behave and why we do the things that we do. And then I spent some time telling you about how to use those principles to engineer or design procedures to increase behavior or to develop new behavior in an individual. Once we talked about this, then we're moving now to the last part of the semester in which I'm going to be telling you about decreasing behavior. Now, what kinds of behaviors would you want to decrease? Well, normally behaviors that are undesirable or behaviors that may be not beneficial to individual himself or might harm other folks. So the last part of the semester will be talking about how to assess those problem behaviors, how to identify the reasons why the behavior is occurring in the first place, and then, of course, designing an intervention that would deal with the variables or deal with the causes of the behavior. Now, if you think about the behavioral model, the things that we've been talking about behavior being influenced by environmental events. So we're not talking about behavior being a symptom of an underlying condition. We're talking about behavior being actually the main subject matter of our analysis. Behavior occurs, and it occurs for a reason. And what reason is this? Well, often behavior, especially operant behavior, which is the majority of the behaviors that we're dealing with, behavior is influenced by its surrounding environment, by a history of consequences, and of course, what's happening at this moment. So we talked about historical variables, and I told you, if behavior is happening, is because there's something currently sort of influencing behavior. So again, behavior occurs because it pays off. Remember, I use that terminology. Behavior has to pay off. Even behavior that is problem behavior, that it might not seem like it would benefit the individual, it pays off somehow, because otherwise it would stop occurring. Like if there's no reason for the behavior to occur, it stops. It stops. So if it's occurring, it's because there's a reason behind it. So we'll talk about that in this unit here. So we talked about behavior, in this case, the B, being influenced by what is happening right before or as the behavior is occurring. We refer to those variables as antecedents, and of course, the consequences that the behavior produces. So what's actually happening? Again, if behavior is occurring, is because it pays off or it has recently paid off, right? So the consequences involve, of course, reinforcement, extinction or punishment, and the antecedent variables involve what we've talked about already in the class: discriminative stimuli, and then S deltas, which are associated with the non-availability of reinforcement, right? Or quote unquote signal extinction, and of course motivating operations or establishing operations that would increase the value of the reinforcer, and of course increase behavior that in the past has produced that reinforcer. Now, behavior is also influenced by competing behaviors, and we refer to that as a concurrent operant situation. I already talked about this in the unit on schedules of reinforcement, but I always like to think of this like every behavior, in a sense, it's occurring, that is occurring, a different behavior could be occurring in its place. So I'm here giving the lecture, and I could be somewhere else. So why is it that I'm here rather than sitting on my couch and watching TV? Well, there is some payoff for doing this, and in this case, it's negative reinforcement. I mean, class, it's coming up soon, and I have to finish this lecture, and I have to post it on YouTube prior to the time of the regular class. So of course, as time goes by, the longer it takes for me to sit down and record a lecture, the more aversive it becomes. And that's sort of the antecedent event that it starts increasing the removal of that aversiveness as a reinforcer. So I'm getting anxious. I'm like, oh, I have to record my lecture. I have to record my lecture. Otherwise, I'm not going to have time to do it. It might be too late. What if something happens with the video? What if it takes too long to upload to YouTube? So the anxiety is building up. I'm getting a little nervous about it. And then, of course, the moment that I sit down and I start recording, the sort of nervousness starts going away and the anxiety starts going away. And then once I'm done, I post on YouTube, then that's the reinforcer, right? It's the negative reinforcer in this case. Like it removes the sort of awkwardness, aversiveness of the event. But that probably competes with other things I could be doing that are maybe less reinforcing. Now, of course, I could be sitting down and watching Netflix, sitting on my couch and watching Netflix. That's quite reinforcing, but it might not be as powerful as the negative reinforcer of finishing the lecture, right? I mean, there's some bad consequences associated with not posting the lecture on time. So if you think about problem behaviors are competing with appropriate behaviors. So if, for example, I'm biting my nails. Now, what would be the appropriate behavior? Maybe having my hands down. And well, maybe there's more reinforcement for biting my nails than there's reinforcement for keeping my hand down. Maybe some problem behaviors are easier to perform than the appropriate behaviors. Now, think the book has some examples of self-injury behavior. Now, self-injury doesn't seem like something that produces a payoff, but oftentimes it does. Maybe that's how an individual with disability that has never acquired functional language has learned to communicate. Well, if I bang my head against the wall, people are going to come and see what's up. So I get some attention. I get people to do things for me. What would be the desirable behavior? Maybe teaching that individual to, raise his hand or her hand, or use some sort of picture activity or picture exchange system to communicate. But those behaviors might be harder, right? The appropriate behaviors might be harder. Same with my dog. My dog may bark to get my attention, and he does that because in the past, when my dog barked, I went to see what was going on. So it's like the dog barks. I'm like, hey, what do you need? And then I'm catering to the dog's needs. Well, what would be the appropriate behavior? Maybe the appropriate behavior would be, to sit in front of whatever it is that he wants, or maybe use his paw to call my attention. I mean, those behaviors may not be very well established. Maybe there isn't a long history of reinforcement for those behaviors. But barking is easy, and maybe there's a long history of reinforcement for barking. So the inappropriate or undesirable behavior here wins over the desirable one, right? So they're competing, they're always competing. So our job is not only trying to understand why the undesirable behavior occurs, but also create a desirable behavior or increase the likelihood that the desirable behavior is going to occur. Now, what is functional assessment? Well, the functional assessment is a collection of methods, right, for us to identify the contingencies or the reason why the function for the problem behavior. So if you have a behavior that you need to decrease, you need to understand why the behavior is happening in the first place, right? So why is it that the behavior is happening? The functional assessment is a tool or a collection of tools to essentially give you that answer. Now, this information from your functional assessment is then used to develop an effective intervention, right? So we are going to now develop a effective treatment. Now, we are going to be talking about the functional assessment in this chapter, and then later I'm going to start talking about components of treatment. So that's what the semester, the rest of the semester is going to look like, the different kinds of treatment that can be used for problem behavior. Now, what does a functional behavior assessment look like? So what to assess? Well, the first thing, again, you want, if behavior is caused or if behavior is influenced by antecedents and consequences, those are the things that you want to look at. So you want to understand when behavior occurs, where does it occur, and with whom. Those are all the conditions that might be relevant for us to predict situations in which behavior would occur. Now, we're going to look at both social and environmental antecedents. So social meaning who is around and when the behavior happens, and environmental antecedents is essentially where does it happen, right? What is, does it happen at school? Does it happen at home if you're dealing with a child? Does it happen at the group home? Or does it happen when the individual is outside or in an outing, if he's an individual with disability? Does it happen at work or does it happen at home? If you're thinking about a typically developing person. Then we need to understand what the problem behavior looks like. So what is it that we are actually dealing with, right? What is the nature of the problem behavior? And what would be the alternative behaviors, right? So if I don't want that behavior to happen, if that behavior is annoying, then what would the alternative behavior be? So maybe the problem behavior is, well, you might be thinking, my girlfriend is really messy. The house is always very messy. There are clothes on the floor. She leaves things behind. She doesn't put things away. There are dirty dishes everywhere. Well, what would you rather she be doing? Like, what would be the alternative behavior? And is the alternative behavior harder than the problem behavior? In this case, yes, right? I mean, leaving the dishes out is easier than washing them. So there might be an issue there, right? You have the concurrent operands here. You can either, clean the dishes, or you can leave them out. And maybe the girlfriend leaves it out because the boyfriend always washes the dishes in the end anyway. So if you think about it, it pays off to, for her to not wash the dishes. She doesn't wash the dishes, and guess what happens? Nothing bad happens, and the dishes get washed anyway, and she doesn't have to do anything. But the alternative behavior is that she would have to wash the dishes, and that's very effortful. Now, What are the consequences? Positive or negative? So what is it that the person gets by engaging the problem behavior? If again, if the problem behavior doesn't produce positive or negative reinforcement, or at least it hasn't produced recently, it wouldn't be occurring. So in the case, well, leaving the dishes out seems to produce a lot of good things. I mean, I don't have to engage in this aversive event, so I avoid having to engage in effortful behavior. So there's some negative reinforcement associated with leaving the house messy, right? Um, what is the schedule of reinforcement? Does the problem behavior, does it get reinforced every time it occurs? So is it on a continuous reinforcement schedule, or is it that, once in a while the behavior gets reinforced, but that once in a while is sufficient to keep the behavior going, right? So that could be an option there. What's the magnitude of the reinforcer, right? So is it more reinforcement for engaging the problem behavior than it would be to engage in the appropriate behavior? Um, what is the immediacy of the reinforcer? Do I get the reinforcer right away for engaging in the problem behavior? Maybe the appropriate behavior doesn't produce a lot of reinforcement, or the reinforcer is sort of delayed, right? It's like if you think about studying, is the behavior that you would want, and the inappropriate behavior might be watching YouTube instead. So you're watching YouTube and you're not studying enough, right? So you're watching all those shows on YouTube, not my lecture. You're watching all those fun shows on YouTube, and you might identify that as a problem behavior. You might say, Dr. Miguel, I'm watching too much YouTube or too much Netflix, and that's becoming a problem because it's taking time away from studying. Like I'm not studying enough because I spend too much time watching TV or watching YouTube videos or whatever. Now, if that's a problem behavior, what is the appropriate behavior? Well, the appropriate behavior will be studying, right? Reading, spending time engaging in the material that I posted online. That behavior is not occurring. Well, let's think about it. What is the reinforcer for watching Netflix? There's you get all this fun content, or watching YouTube videos, you get all the fun content, and is immediate. You watch it, and it's nice and it's fun and you're laughing. The magnitude, the reinforcer it's a great value. It's on a continuous reinforcement schedule. Every time you watch, it's fun. It's a lot of reinforcement and is immediate. How about studying? Well, studying is effortful. Studying might be a little boring. And what's the reinforcer for studying? Well, it might be negative reinforcements, like, well, avoid getting a bad grade. And that's also delayed. It's not immediate, right? I mean, you have to take the exam, wait for your grade, wait until the end of the semester. And maybe there's some positive component to learning the material. But, the positive components might not be as much fun as watching TV. I mean, I would much rather be watching Netflix than recording this lecture. That's the reality of it. But again, like I mentioned, there's a lot of negative reinforcers or punishment associated with not completing the task. And of course, completing the task produces some negative reinforcement. So those are all things associated with it. Now, what kinds of reinforcers do we get? Right? So behavior in general is maintained by specific kinds of reinforcers. What are they? So what maintains behavior? We can essentially break down reinforcers for behavior in those four major categories. Now, I challenge you to put on the discussion board some other kinds of reinforcers, and if you think that they don't fit in those categories, and I probably will tell you how they do. But I think you can break down consequences for behavior in four main categories. Let's talk about them. What are the functions of behavior? Now, here we talk about problem behavior, but behavior in general, whether it's appropriate or inappropriate, produces consequences of the sort that I'm going to be listing here. The first one is social positive reinforcement. So behavior may produce reinforcement that is mediated by others, and that's the part of social reinforcement. So when we talk about social reinforcement, we're talking about behavior that is maintained or by others. So the reinforcer is delivered by other people, and that's why we refer to it as social reinforcement. Now, positive, so social is delivered by other people. Positive, remember, has to do with the fact that something got added, something got produced. The behavior produced a change in the environment that usually refers to something happened, the addition of something, right? So a lot of social positive reinforcement comes in the form of attention. And attention is kind of an omnibus term, is like this general term for usually other individuals' reactions to your behavior. Sometimes the reactions are sort of perceived to be, nice, or positive, in a sense that you may make a inappropriate joke, and maybe you shouldn't be making an appropriate joke, but there might be your friends may have laughed at that joke, so you're more likely to say inappropriate things. But sometimes behavior may produce what we refer to as negative attention. So I may make an inappropriate joke and my parents might yell at me. And if that actually makes me make more inappropriate jokes in the future in the presence of my parents, then you could say that my parents yelling at me served as positive reinforcement, right? You would think, well, my parents yelled at me, my behavior should decrease. Well, if it does decrease, then your parents yelling at you would serve as punishment. But if your parents yelling at you made you continue engaging in the problem behavior, you're still making inappropriate jokes, then we could say, well, your parents' attention, in this case, negative attention, served to increase the likelihood of your behavior. So them yelling at you was a form of social positive reinforcement. Sometimes I see that happening with people that own pets, right? The pet engages in a problem behavior. Maybe the pet pees on the carpet, and you catch the dog peeing on the carpet, and then you say, stop doing it. And the dog is like wagging his tail. Well, you could say that you yelling at your dog actually served as social positive reinforcement in the form of attention. Again, it was kind of a negative type of attention, but yet it increased the behavior. Your dog might now pee more often because that produces your attention. Praise, of course, is an obvious one. Praise may function as a reinforcer. Again, those things may not function as reinforcers for everyone, but if it does, then you could say that praise is a form of social positive reinforcer. So if it increases behavior, we refer to the process as social positive reinforcement. So like reactions is a form of attention, activities and things. So if your behavior produce items, like, for example, a problem behavior might be stealing. Well, what does stealing produces? Well, the item that was stolen, right? And that is a tangible, something that the person can use. And that would be a form of social positive reinforcement. And uh, um, positive in a sense that um, you had, you didn't have something, and now you engage in the problem behavior, now you get something, right? How about social negative reinforcement? Now, with social negative reinforcement, the social part is mediated by others, and the negative reinforcement is now the behavior gets to remove something, like, and again, the something is mediated by someone else, right? So, for example, someone else presents you with tasks, like, okay, Kyle, I need you to come here, help me pack my clothes because I'm moving, so I need you to help me move. So can you help me pack my stuff? And I might say, oh, I have a meeting, I have to record my lectures, then I have a Zoom meeting, I can't really do it. Maybe I don't have to record my lecture, maybe I don't have a Zoom meeting, I'm engaging, I'm lying, which would be an inappropriate behavior, and I'm doing that to escape from the tasks that were presented to me by someone else, right? So social negative reinforcement may come in the form of escape from tasks, escape or avoid activities, or escape or avoid interactions, right? Um, Sometimes people that work with individuals with disabilities, individuals with disabilities may engage in problem behavior to sort of avoid having to engage in whatever tasks are going to be presented to them. And again, is mediated by others. Then we have another category or two other positive and negative reinforcement categories that now um, are not mediated by other people. So in this case, no one is involved. Problem behavior may occur because it produces some form of automatic reinforcement. So it's not mediated by anyone else. Oftentimes, the automatic positive reinforcement, it's a behavior that produces some sort of sensory stimulation. Now, before I talk about this, it's important that we realize that all behaviors produce some form of sensory stimulation, even behaviors that are mediated by others. So here's an example. When I engage in verbal behavior, when I'm talking to someone, um, oftentimes the person responds, right? So you could say that if I say, hey, if I'm walking by and I see you and I say, hey, how's it going? And then you respond, hey, I'm doing fine, Dr. Miguel. How's everything going with you? I was like, great. So maybe next time when I see you, I'm more likely to ask how you're doing. Why is that? Because when I asked, you responded. So you responding reinforces my behavior of asking, right? So my behavior of asking is maintained by social positive reinforcement, right? So I talk to you, you talk back. So by asking a question, I produce some form of attention that came from you, so mediated by you. So that's social positive reinforcement, right? Well, but when I'm talking, I am also producing some automatic consequence. When I talk, I can hear myself, and sometimes hearing myself serve as the reinforcer for my own behavior. Well, that's what's happening now, isn't it? Now, of course, the behavior of talking and lecturing in the past has been reinforced by students sitting in the classroom, nodding, taking notes, smiling, all of these behaviors that you engage in when you're sitting in the classroom serve to reinforce my behavior. So if I'm lecturing and I give an example and I see that you guys are all nodding and saying, yeah, I understand, then I may move on to another concept and explain something else. But if I give an example and I see that you all look at me with a face of, puzzled face, like, oh, I don't know what you're talking about, then that might not reinforce my behavior. And then I may try a different example and a different one until my behavior produces some sort of positive reaction. And then I'm like, okay, I did it. Now I can move on. And then in the future, I'm more likely to use the example that you guys understood, or at least you told me that you understood, or you nodded. Now here, I don't have an audience. I don't see you. I don't know what you're thinking. So what is actually reinforcing my behavior? When I'm talking, I hear myself talk. And if what I'm hearing sounds reasonable, then it reinforces my behavior and I keep going, right? Sometimes you would see, I don't edit this. So I may say something incorrectly and then I may go back and correct myself. And now I hear myself say things and I'm like, oh yeah, now I said it right. So all of our behaviors have some automatic function or automatic reinforcement. But when we talk about problem behaviors, they're primarily maintained by automatic positive reinforcement. We're talking about behaviors that might occur regardless of who's around because they're maintained, they produce sensory stimulation. So let's imagine a problem behavior of someone engaging in psychotic talk. Maybe the person just is talking and talking to himself or to herself, and that is sufficient to maintain the behavior. No one needs to provide reinforcement. The person produces its own reinforcement, right? A lot of individuals with disabilities may engage in self-stimulatory behavior or repetitive behaviors, and those repetitive behaviors may produce some sort of stimulation that they're missing. Maybe they don't have a lot of skills. Maybe they don't communicate really well. So therefore, they have to produce their own reinforcers. I don't know if any of you have been to a zoo that maybe had very small enclosures or the environment wasn't very enriched for the animal. First of all, it's very depressing because you're like, oh my God, this is a very small enclosure. this poor animal doesn't have enough space to run around. And one way to find out whether the enclosure is big or not, I mean, I'm sure that there are some specific um, um, rules and regulations for how big, and there's probably a lot of data suggesting how big some enclosures might be. But if an animal is confined to a small space for too long, you start seeing some repetitive behavior, right? You might see an animal pacing back and forth. And why is the animal pacing back and forth? Well, it could be because the environment is so impoverished. There's not enough going on that the animal needs to engage in some behaviors to produce some form of stimulation. So by pacing back and forth, the animal is producing some sort of stimulation that, of course, reinforces the behavior of pacing. So the animal may spend all day going back and forth. And sometimes individuals that have poor social skills or they have poor verbal repertoires, they cannot really go around and produce a lot of reinforcers themselves. So they might engage in repetitive behaviors because those repetitive behaviors produce some sort of stimulation that they need. And then you have automatic negative reinforcement, and that usually involves some sort of relief from pain, anxiety, of other aversive stimulation. Here's an example. Imagine that you have an itch, so you scratch yourself. Now, having an itch is some sort of aversive event that when you scratch, you remove the itch. Now, is this positive or negative reinforcement? Well, negative, right? Because you have an aversive event, you have the itch, you scratch yourself, that's the behavior, and then the itch goes away. So you had an aversive event, you engage in the behavior, the aversive event goes away. So in this case, negative reinforcement. Now, is it social or is it automatic? Now, was it mediated? Did the itch go away because someone took it away? Was it mediated by someone else? Or did you remove the itch yourself? Was it automatic? In this case, would be automatic, right? A lot of compulsive behaviors, obsessive compulsive behaviors, might also be negative reinforcement operating in the automatic kind. So I might be very anxious. I have some anxiety here, and then I've learned to, engage in the behavior of compulsive behavior of going up and down the stairs 20 different times. And after I do that, I feel better, right? So I was feeling anxious. I go up and down the stairs 20 times. Now I feel better, right? So again, negative reinforcement of the automatic kind, right? So again, problem behavior may be maintained by social positive reinforcement, social negative reinforcement, automatic positive reinforcement, and automatic negative reinforcement. Those four functions of behavior are very important for you to understand. When you read the chapter, try to understand and identify examples of problem behaviors that are maintained by those four functions. This is the most important part of this chapter, and I really want you to understand this really well, right? Now, here's some examples of problem behaviors that behavior analysts have been dealing with, especially those behavior analysts that work in the clinical setting. A lot of behavior analysts work with individuals with disabilities. Those are some common behaviors that I have seen in some of the possible health implications. And again, those behaviors may occur for any of the reasons that we described earlier, right? So pica, rumination, hand mouthing. So take some time to read the health implications here. Eye poking or eye gouging, face or body scratching, especially if it happens too often, hand and body biting. So biting oneself or biting others. I have a mark on my leg from a client that I worked with that bit me. It was a small child, so my leg was the obvious place for the child to go and bite. Hitting and slapping, head, face, and back banging, ear poking, aggression, and elopement. I have probably dealt with all of these behaviors in my career as a clinician. Now, the important thing is that there is no manual on how to treat those things. So it's not that you know, body biting or hitting is always automatic positive reinforcement or is always negative reinforcement of the social kind. It could be any of those functions. One child might be biting to produce attention in the form of social positive reinforcement. Another child might be biting to produce social negative reinforcement. The behavior looks exactly the same in child A and child B, um, but the reason why the behavior is occurring for child A is different from the reason the behavior is occurring for child B. And the treatment then will be different because the treatment is not based on what the behavior looks like. The treatment is based on the function of the behavior, right? So that's important. The same child may be biting to produce attention in one condition, and in a different condition, the individual might be biting the same individual might be biting to escape from demands, for example. So then the treatment for the biting to escape from demands will be different from the treatment for the biting that produces attention. So those two behaviors, they look the same, they're occurring, the same person is engaging in them, but they're different behaviors. They're different behaviors because they are producing different consequences, right? And our treatment is not based on what the behavior looks like. The treatment is based on the function of the behavior, right? The function determines what treatment you're going to use. We're going to be talking about treatment in the next few classes, but it's important. So let's think about some examples of things that we talked about in the past. Let's imagine you have a 4-year-old child that tantrums all the time. And it does so when requests are made by the parents during preferred activities. So the child, makes some requests when the child is engaging in preferred activities, or the parents make some requests um, when the child is playing with a toy that she likes. And when the child tantrums, she escapes from the request, meaning the parents say like, okay, you don't have to do it. Now, what's the possible reason why the behavior is occurring? Now, if the antecedent is the parents make requests to the child engages in the problem behavior, and the problem behavior produces escape from the request, let's think about this first. Now, is it positive or negative reinforcement? Now, you should answer negative reinforcement. Why is that? Because the child gets the requests, which are aversive, engages in the problem behavior, request goes away. So there's an aversive event, requests, and the behavior removes the aversive event. Therefore, behavior makes things better by removing an aversive event, negative reinforcement. Is it automatic or is it social? Well, in this case, your answer should be social. It is social reinforcement because the parents then remove the request, right? So in this case, social negative reinforcement. Yep, I was right. Now, a four-year-old, same kid or different kid engaging the same behavior, tantrum, but now the behavior occurs when the child is told she cannot have something she wants. And then when the kid tantrums, she gets what she asked for. Now, the question here is this positive or negative reinforcement? Let's think about it. Does the kid get something or is something removed? Well, doesn't have something, engages in tantrum, now has something. That would be positive reinforcement. Is it mediated by someone or is it automatic? So social or automatic? Well, the answer here should be social. So social, positive reinforcement. In this case, we refer to as tangible. The kid gets a tangible, right? So it's in the form of tangible. Whoops, you saw the answer here. So 10-year-old hair pulling, and that's occurring when the child is alone, is having negative thoughts and emotions, and when the child pulls her hair, then relieves the emotions, right? Relieves the negative thoughts and emotions. Now it's an aversive event, the negative thoughts. Pulling the hair removes the aversive events. That's negative reinforcement. And again, in this case, you'll be automatic, not social. No one needs to be around. So automatic, negative reinforcement. Here's a 6-year-old with autism that engages in some hand waving, so it keeps just doing that a lot. It usually does it when she's alone, not engaging in any task or interaction, and as a consequence produces visual stimulation. Now, is it positive or negative? Nothing is going on. The child engages in hand waving, and now it produces visual stimulation. There was no visual stimulation, problem behavior, visual stimulation. Is this positive or negative? The answer should be positive. And is it automatic or is it social? In this case, the child is doing it alone. No one is to be there for the reinforcer to be produced. Clearly automatic. So automatic, positive. See what my time is here. Okay, we have a few more minutes. 17-year-old hair pulling. And again, the child is alone, pulls the hair, it produces tactile stimulation. Maybe the child likes the feeling of the hair in her hand, likes to manipulate the hair, play with the hair. Now think about it. I didn't have the sensation. I pulled my hair. Now I have the sensation. Is this positive or negative? No sensation, problem behavior, sensation, positive. Is it automatic or is it social? In this case, automatic. So automatic, positive reinforcement. Now, 17-year-old hair pulling of others. Now, kid is pulling other people's hair. That's terrible behavior. And when is it happening? When the child is watching TV, mom is busy in the room, kid goes there, pull someone's hair, pull mom's hair, and mom gives attention. Now, what kind of attention mom gives? Probably mom yells at the kid, right? But the kid is alone. It's not getting any stimulation. Now, when the kid pulls the hair, the kid gets some stimulation. Now, question, is this positive or negative? Positive, right? The kid has no attention, pulls the hair, attention. Now, is this social or automatic? Who is giving the child attention? Someone else, mom in this case. So this would be social positive reinforcement in the form of attention. 80-year-old biting her wrist. Now, during toothbrushing, the kid has to brush her teeth, but the kid has sore gums, so doesn't like to brush her teeth. Mom says, let's go brush her teeth. The kid bites her wrist, and then by biting her wrist, the kid is preventing or avoiding having to brush her teeth because mom has to deal with that. Now, in this case, positive or negative? Well, escape, negative reinforcement. And what do you think? Social or automatic? This case, both, right? Social, because she's escaping from the task that is being presented by mom, and automatic, because she's also escaping from the pain of the sore gums, right? So sometimes, as we will see, behavior could be occurring for a variety of reasons, not only one. That makes things always complicated. Things are not as simple as we think they are. 18-year-old self-scratching, kid is alone or individual is alone, there's a bug bite, and then relief from itch skin. We talked about this already. This will be escape, right? So you're escaping from the pain or the itch. And because the kid is alone, no one is around, it will be automatic negative reinforcement. So when we're talking about decreasing problem behavior, we're talking about identifying and defining the problem behavior, right? If you don't know where you're collecting data on, if you don't have an operational definition, and if you don't remember what an operational definition, you can go back to the first couple of chapters in the book that talk about identifying behavior and defining the behavior that you want to study and you want to measure. You have to identify and define the problem behavior in measurable ways. Then you have to initiate data collection. And how do you do that? Remember, also in the first few units, we talked about measuring behavior, different ways of measuring, right? You're measuring frequency. Are you measuring using partial recording? Are you doing momentary time sampling? It's going to depend on the behavior you're looking at. We already talked about all different ways of measuring. What are you measuring? Are you measuring frequency? Are you measuring magnitude? Are you measuring latency? Are you measuring duration, right? It's going to depend on the behavior. Once you have to identify how you're going to measure and what you're going to measure so you can initiate data collection. Then you need to complete a functional assessment. You're going to run your assessment to find out if the behavior is maintained by social positive, social negative, automatic positive, automatic negative, and what do those look like? So is it positive, social positive in the form of attention? Is it social positive in the form of getting something, a tangible? What does it look like? Based on your functional assessment, you're going to generate hypotheses about the antecedent variables, their triggering behavior, and the possible consequences that are maintaining behavior. Behaviors occurring under those circumstances, and it usually produces specific consequences. Once you have your hypothesis, you can then develop a treatment by manipulating the antecedents. We're going to have a whole chapter talking about that, and changing consequences, and usually teaching a new behavior that will replace the problem behavior. We're going to have chapters and lectures on all those things. Then once you develop you develop and implement the treatment, you're going to be taking data to see if the treatment is working, and that's the evaluation part. So is it working, right? Is it my treatment that is working and nothing else? If the treatment is not working, of course, you're going to have to find out why. Oftentimes, treatment is not working, and it could be because the functional assessment was not conducted correctly. So you may have identified antecedents and consequences that are incorrect. If the problem behavior, let's say, is maintained by escape, and then you did a functional assessment, and it said in your functional assessment that is maintained by attention. If you design an intervention based on removing attention, but the behavior is actually occurs to escape, then your intervention is not going to work. So sometimes it could be that the functional assessment needs to be conducted again, and I'll give some examples of problems with functional assessment. And what's the risk of implementing a procedure that doesn't match the results of your assessment. I'll talk about that. Sometimes your functional assessment actually yield the accurate function for the behavior, but the treatment was the wrong treatment. You designed the incorrect treatment. So the treatment doesn't match the results of the functional assessment. That could be a problem. Or maybe the FBA, or the functional behavior assessment, yield the accurate function for the behavior. The treatment is the correct treatment, but it could have been implemented incorrectly. Sometimes there's poor treatment integrity. There's lots of research nowadays in behavior analysis talking about treatment integrity and how implementing a treatment poorly may have important implications for the results that you get. Dr. Dennis Brand here at Sac State in the psych department primarily studies treatment integrity and the effects of integrity and how to make treatment better, or get people to implement those treatments more accurately so they work better. Now, I'm going to start talking about identifying and defining problem target behavior and all those different points that I mentioned right here, all those 5 points. And then later, the different kinds of functional assessments in the next lecture. So for now, you don't have to watch any of the videos yet, because a lot of the videos are related to functional analysis. We haven't talked about experimental functional analysis yet. So my suggestion is that you read the chapter and then wait for the next lecture, which will be on Wednesday. It'll be posted on Wednesday. Again, please make sure that if you have any questions, you either come to my office hours, or you post on the discussion board, or you can send me an email. Hopefully, all of this will end sooner than later, so I can see some of you guys in person. I miss being in the classroom. I miss interacting with you. I'm sure that you guys miss coming to campus as well, but we are all in this together. Stay safe, and I'll see you guys soon. Goodbye.